on inhalation that the occiput is drawn into flexion and the greater wings of the sphenoid laterally rotate as the temporal bones externally flare. On exhalation, or when the primary respiratory system is leaving the area, both motions will occur. One is of the greater volume change than the other, the diaphragmatic being of greater volume change. We have internal rotation of the temporals. We get an elongation of the occiput and an internal rotation of the greater wings of the sphenoid. This is diaphragmatic inhalation.
So that was Dr. Mark Pick displaying a couple of the cranial bones doing their cranial rhythmic motion. As we saw in the first video, just grossly all the bones moving in succinct or together, and here you can see unilaterally or singly bones moving, basically starting from the pterygoid and the occiput, incorporating the frontal and the occipital, the temporals and the parietals, and they're all moving with respiration and the cranial sacral rhythmic flow of the CSF, cerebral spinal fluid. So what I want to show you here on these two quick models is come on in here and look at these two pictures for me. Get this really big. So here's the base of the skull. You can see the foramen magnum, and all these openings, foramen, are where nerves, arteries, and veins are exiting. Come over here and let's look at the cross-section of the skull. Now we're looking at a bird's eye view of the skull, and you can see the different colored bones, and again, the openings. And so if there's any restriction in cranial motion, then what will happen is the actual anatomic structures, the arteries, nerves, and veins exiting from the skull proper, going to the exterior of the skull, will be inhibited in their movement or ability to go to that structure, organ, or muscle that they're trying to get to. So if you have two ways of causing asymmetry in a skull in a newborn, one is they're sitting that way for weeks or months in an awkward position, the cord wrapped around, a hand high, breech, and so when the kiddo comes out, there's been some asymmetry of pressures on the skull. The second way, and that's been that way for months, the second way is the actual birthing process where the kiddo comes through, their skull intercesses on itself purposely so it can fit through the canal, and then when it exits, it doesn't fit or sit properly thereafter in a short enough amount of time. So either of those ways can cause asymmetry in the newborn skull, causing potential pressure on nerves, resulting in certain symptoms.